Respected judges, teachers, and my dear friends, a very warm good morning to all of you. I am Simran Sharma, student of Dayanand Mahila Mahavidhalaya, Kurukshetra. Today I am here for my presentation on the topic mental health and COVID 19. This is my overview of my presentation. Now, the first question arises that what is COVID 19? COVID 19 is a family of viruses and its origin is the Wuhan, the city of China, and it is now considered as a pandemic due to the fast increase in its positive cases in different countries. Now, we study the impact of COVID 19 on our mental health. First is stress. Stress is all about the responses to demands. There are different types of stress. First is nature. First we have the nature of event. For example, the natural calamities like earthquakes, tsunamis, floods, etc. And the one add-on is sources of stress. For example, the heavy workload, personal issues, any harm, and many other things. Now the stress responses, there are many stress responses like physical, emotional, behavior one, social one, and cognitive one. Every If we're standing with the physical one, then the pains and aches due to the continuous working, continuous sitting on a one place and continuous using your phone, and the heavy workload causes a sleep disturbance. Emotional, there is a fear of being affected by the COVID-19, anger because you are restricted from everything, and sadness because you are alone in the isolation and quarantine. Behavior, risk taking, refusing orders because it is not able to complete your orders from at home because you have no, there is a lack of proper tools and instruments. And next is cognitive confusion and misunderstanding due to the rumors that is spread on the social media. Social, that you are not able to meet your family, friends, society, etc. You are alone in the isolation and quarantine. Next is common responses to COVID-19. Everybody have a fear that fear to be being infected by the COVID-19, and there is a great impact on the business and economy of the India. So the many businesses uh, are very affected by the COVID-19, so the jobs of many peoples are lost. So there is a financial issues, and many there is a health workers like doctor and nurses who are not able to meet their family, friends, childrens in this pandemic because they have to work 24/7 in the hospitals due to this COVID-19. And powerlessness, helplessness, boredom, and loneliness because you are quarantined or you are isolated or there is a lockdown, so you are not able to go out from your from the home. So next is additional responsibility workload. You have to work from home and you have to spend more hours than a working hours, and it is a new experience for the worker, so it is very difficult. And risk self-care and information of long time exposures. Lack of social support because you are not able to meet your family, friends, society. You just call them or use social media. Next is stigma. There is a stigma, there is a negative reaction of the community to the COVID-19 patients or the health workers also. Strict measures need to have protective equipment like mask, sanitizer, and many other equipments that are told by the doctors or the governments to use it necessary. Long term consequences, the stigma out the survivors. हमारे survivors are very that the survivor is a great stigma in today's life. Social isolation and decreased social networking because we are socially isolated, so there is a great decrease in the social networking because families, friends are so far to us. Pent up emotions and violence, mistrust and misconception, rumors. Social media is spread a great rumors than the true information. Relapse and negative outcomes. Now the general tips that we have to do: sleep well, eat well, be positive, exercise and yoga, take time to relax, make a schedule for your daily activities, follow a routine, deep breathe, be positive. And the tips general that do not for self social isolation because you are not physically able to meet your friends or family, but you have to be connect to them digitally by the social media. And alcohol and drugs is a it is alcohol and drugs cause a very bad effect on your health in this pandemic. And false information and rumors, there is a many rumors, please don't believe on them because it creates a lots of misunderstandings and confusion. Now, specific to children, concern, difficulty in expressing separation or disengagement, tantrum, and irregular routine, risk of infection, and uh, the parents have to make a management for their children's, make a schedule, and develop their hobbies, for example dancing, singing, etc. Make a proper routine, and give them creative activities, positive way to express being sensitive. And specific to older adults have more fear of this infection, and they use very limited use of online or social media, and they have a very low immune system. So there is a many precautions that they can take, so help to cope them. Use social media, be attached with society by the social platforms, give clear and reported information on ongoing issues and medical needs, take and please take home remedies. Specific to quarantine, during quarantine you have a fear of infection, frustration, boredom because you are not able to meet in the society, inadequate supplies because your family and friends are not able to give you the proper supply of the things that you need. And after the quarantine, your returning to your normal schedule is very difficult, and the financial issues are also there because you are not doing your work from the last few days, because you are quarantined. And there is a stigma also. Next, the conclusion. The conclusion is that awareness about the self during and the crisis stressful situation is very necessary. Identify stress responses, for example physical, emotional, behavior, cognitive and social. Manage your mental health and psychosocial well-being by practice the strategies to manage the stress, and immediately consult and seek help from your doctor, family doctor, or the nearest hospital. So thank you and have a nice day.